a brief review on how to obtain a nasopharyngeal flu swab from your patient and that collection process. First, here are all the supplies that you'll need to obtain. You'll need the flu swab itself. This will be the flu swab that has the flocking portion on it, as well as the media. You'll need a barrier, whatever personal protective equipment you require, a face shield, and a mask. You can also use a face shield that has a mask attached to it or any other disposable goggles, your gloves, foam for hand hygiene or soap and water, as well as a box of tissues. Whenever we're obtaining any respiratory specimen, we should make sure to wear the appropriate personal protective equipment so as to not be exposed by the bodily fluids. First, you want to explain to your patient that they may gag, cough, or feel the urge to sneeze during the procedure, but it should take less than a minute to obtain the specimen. You're going to have your patient sit towards the edge of the chair or the edge of the bed facing you. You will have them blow their nose. At this point, you want to make sure that you've done your hand hygiene, and then you're going to put on whatever your protective equipment is. So I'll don a pair of clean gloves, put on my face shield, as well as my mask. And then now we'll check for patency from our patient. If I had a pen light, I could see or observe for any occlusions. I can also have them obstruct one nostril, take a deep breath in, and then exhale. So based on this, we'll see whichever one has better airflow, and that will be the nostril that I use. Cool. Now we're ready to obtain our specimen. So we're going to open our flu swab, making sure to not contaminate the swab itself. You've got your swab as well as your media. We're gonna open the swab without contaminating it. And you'll see that there's a red mark on the swab that indicates the fracture point. That part is what will be put into the media when sending the specimen to the lab for testing. So we want to instruct the patient to gently tilt their head back, and then we're gonna pass the swab into the nair to the nasopharyngeal passage. So gently following the curve of the nasopharyngeal passage, you'll reach the back, and then you're going to twist the swab about 5 or 6 times to obtain those epithelial cells. This part may be pretty uncomfortable for your patient, so they might tear up. So then you'll pull out the specimen, and now we're going to place it into the transport media. So open your cap. Making sure not to touch the sides of the container. So introduce your sample, break it at the fracture point, snap it, cap it, make sure we close it tightly, and then we will label this in front of the patient, clean up the rest of your workspace, make sure that your patient is comfortable and everything. And then after that, you will print the requisition, verify this with a colleague, and then this specimen needs to be sent to the lab on ice. Okay. Here is a close-up view of the procedure. You have the swab itself, as well as the media and your patient. You're going to open that swab, making sure to not contaminate it when removing it. And if you note, you'll see this red dash on the swab. That indicates the fracture point from where to snap off the specimen when placing it in the media. So we've already instructed our patient to blow their nose and tilt their head back. We're going to take the swab and gently introduce it through the nair following the septum floor. Go all the way to the back of the nasopharynx, and then we'll spin it about 5 or 6 times to pick up those epithelial cells. Then we'll pull it out, and now we're able to snap it off and place it into the specimen container. We'll take off the top of the media. Place the swab into the media, being mindful not to touch the sides or the top of the container. Place it into the media till you hit the fracture point. snap it off, snap it, cap it, label this in front of the patient, and then follow the rest of your procedure to dual sign this and then send this off to the lab. This media may be used for a variety of other specimens as listed here on the tube, but the procedure will remain the same for any nasopharyngeal swab or specimen collection.